My name is Dr. Stephen Viess. I'm a fellowship-trained sports medicine specialist at Webster. The rotator cuff is a series of 4 muscles that start around your scapula or shoulder blade and then move out to the side, essentially encircling your shoulder joint with the tendons of those muscles. A tear is when any of those muscles have been injured and have torn away from the bone where they attach to the shoulder. Rotator cuff tears can occur through several mechanisms. In the younger population, they tend to occur through either one single traumatic injury, such as a car accident or a fall, or through repetitive stress, such as what you might see in a pitcher. In the older population, they tend to be more the accumulation of wear and tear over the years, and you'll often see someone who has had some mild shoulder pain for years and then feels a sharp pop while doing something that seems relatively minor, such as putting a carry-on bag into an overhead bin. As far as treatment for rotator cuff tears, there are several options. For some people who are either low demand as far as their activity level or who have very small or partial tears, they can be improved significantly with either physical therapy or a steroid injection. But if you have a significant tear, the typical treatment is surgery. The most effective way to repair it is through an arthroscopic repair where we fix it through the camera using very small incisions. There are several advantages to having your rotator cuff repair done arthroscopically. In the past, the only way to fix it was through a big incision in the shoulder. The problem with that is you have to divide the muscle, you have to go through different layers, and there's much more recovery as far as getting the muscle to heal in addition to the rotator cuff itself. Now through smaller arthroscopic incisions, you can essentially spare the bigger muscles of the shoulder and concentrate only on the repair of the rotator cuff, which tends to make the recovery less painful and smoother. After arthroscopic rotator cuff repair, you can typically expect to spend 6 weeks in a sling with minimal motion, although we often start physical therapy at 4 weeks. As far as full recovery, it takes most people about 3 months before they can perform all their day-to-day activities, and 6 to 9 months before they feel as good as they did prior to surgery.